Now I think we're ready to resume with Mr. Gough. Yes. Good afternoon, Mr. Gough. I think we're ready to start again. Probably we'll go on to about 4 o'clock, but again, if you want to take a break, just say so. Now, Ms. Duncan.
Thank you, my lord. Good afternoon, Mr. Gough. I was going to move on now, Mr. Gough, to September 2018. And again, I think we'll just try and establish the timeline first of all, and then maybe look at. I think I'm right in understanding that John was admitted, I think, on the 3rd or the 4th of September 2019 to the paediatric surgical ward. Is that correct?
Yeah. And
was that to have, as we discussed earlier, the kidney removed and then the tumour examined?
Yes.
Is that right? Can we begin then just to sort of think a bit about the environment that Ward 3B comprised and your experience of that? So, am I right in understanding from your statement that when you and John arrived, the room that John was to be staying in was not at that point ready?
No.
Is that right? And you were shown to the playroom, is that right?
Yes.
And do you have any observations about the playroom?
Yeah, it was not set up same protocols as the Cuddihy rooms, so had free access to anyone and everyone. And everything was accessible, so there wasn't the cleaning regimes, and it was a playroom. It wasn't a Cuddihy playroom; it was a playroom. So certainly we didn't really access it because it wasn't a clean.
It wasn't set up for compromised children.
It wasn't set up for. It was clean, but not Cuddihy clean. It was visually clean, but we couldn't trust it.
And when John's room was eventually ready, and you were shown to that room, do you have any observations about the room itself?
Yeah, we actually had to get the bed changed because there was brown matter on parts of the bed. Now, I don't know what the matter was, dark, reddy brown. Could have been blood, could have been poo, could have been iodine or something like that, but certainly it was, and shouldn't have been there, so they took the bed away and changed it, and then we cleaned the room. Straight afterwards, I went along to the playroom, and they had Fennel, was the wipes that we borrowed those and cleaned the room top to bottom because we weren't confident in it at that point.
And can you remember whether there were tap filters?
No, they weren't at that point.
Yeah. And just maybe to complete the picture in relation to the room itself, what were the arrangements for parents staying overnight by way of provision of a bed?
Now, I think that one had a fold-down bed, if I remember rightly. Could be wrong. I'm sure that.
I mean a Z bed, effectively.
I can't remember whether it was a Z bed or fold down off the wall. Not sure.
Is it correct that at least in some of the wards that you were in, out with the Schiehallion unit, beds that were provided for parents were not of the fold down variety?
No, absolutely, and that became a problem because the Z beds they were okay, but within a night, after a night of sleeping in a Z bed, your back was gulped. Certainly, new Schiehallion beds were folded up, and the ones down when we were down in CDU, which is on ground level, was those type of beds. So there certainly were rooms. That one might have done. So it was actually, but
just in relation to the cleanliness point, something that you mention in your statement is that at some point in your bouncing in and out of the hospitals, as it were, you started to bring something with you called a crash bag.
Yes, John moved around different wards. The nature of his illness. When he was admitted, we couldn't always guarantee that we went into Schiehallion, particularly when the size of Schiehallion was reduced to go to New Schiehallion, Ward 6. Therefore, because each ward was different, you had to be able to cope with whatever scenario you were going into. So the protocol on Ward 3C might be different to Ward 3B, and what you could access in each ward was slightly different. So to make sure we had all the requirements, we had to cover all bases. The first thing was packing something to clean the room with, because having had the experiences of going into a room where the bed was dirty and then headline infection, we trusted nothing. And then, so therefore, first thing we did, and what I ended up doing was, I was always the first person in when John had a temperature spike. It was me, because I was the one that physically could, not strong, but you had to carry so much because you needed to carry, well, if we're going into a ward that doesn't have a safe playroom, you have to carry toys. If you're going into a ward that doesn't have a facility to make food, you have to carry food. Yeah, if you're going into a ward that you've got to clean, which was most of them, because they weren't Schiehallion, you had to carry cleaning stuff. So if you're going into a ward where access to bottled water was not as easy, you had to carry water. So you had, it became camping. It was like, and that's the only way I could describe it. You had to have everything there, and you didn't know which ward you were going to be in until you were in there. So you had to carry that. But my first thing when I went in was to clean the room, top to bottom, and it's amazing what you found. You know, I remember finding underwear, adult underwear, in a drawer that was supposed to be cleaned. That I forget which ward it was. So we were quite, certainly wasn't Schiehallion, but one of the peripheral wards. So you couldn't trust anything.
Okay. And when you were on Ward 3B, can you remember if there were any warnings about the use of water?
Don't think there was.
And again, maybe just to go back again to echoes of the evidence earlier this morning, in terms of the seniority of doctors in Ward 3B, were there first-year doctors? Yeah.
So which was problematic, which I'm sure we'll talk about later.
Well, I wanted to move now to just look at events on Ward 3B. And again, I'll walk you through the timeline that you've helpfully provided, and then we'll stop and we can look at some of the detail. I'm right in understanding that John had his operation, and I think he went to the paediatric intensive care unit, is that right? And that would be, I think, the 4th of September.
Yes, yes.
And spiked a temperature
Yep,
while he was on the paediatric intensive care unit.
yep.
And a line infection at that stage was suspected.
Yes.
Now, at that point, was that something that you were particularly concerned about, or did you have your mind on other things at that point?
Our biggest concern was him spending 8-10 hours getting a kidney removed. Yeah. So that was where our head was.
Yeah. So after that, I think following day, in fact, I think we went back to Ward 5B.
Yes.
And was that into a standard room rather than a back room?
Yeah, that was into a standard room.
Yeah, and just again to recap maybe on what you've said, that was a room with no water filters? No
water filters. The only nod to John's being immunocompromised and everything that was going on around about him was he was placed in a room that was closest to the nurse's station. But apart from that, there was nothing. There was no protocols being.
So this wasn't the Schiehallion umbrella?
No, absolutely not.
And at this point, what sort of shape was John in?
It wasn't great. He'd had he'd just had an organ taken out. He was undergoing chemotherapy and has cancer. He's also taken a huge reaction to some of the chemicals that they use, because one of the natures of chemotherapy is it makes you more likely to be allergic to stuff. So he'd had a huge reaction to one of the chemicals they'd used to clean his skin, which ended up being treated as a 3rd-degree burn. You know, it wasn't a burn, but that was the only way they could do it. So he had that as well. So it wasn't great.
And that, am I right in understanding from the statement that was causing John quite a bit of discomfort?
Yeah. That we latterly, not that day, but we ended up having to hold him to stop him from, because burning, scratching. It was a burn. The only way we can describe it as a burn.
And there was also at this point the unresolved question of whether there was a line infection.
Yes.
Is that right? And if we then move into the following day, am I right in understanding that there was an attempt to take blood from him? And am I right in understanding that they took blood from his line? And also there was an attempt to take blood from him from other parts?
Yeah.
Now, do you want to walk us through that and just explain what was happening?
From my understanding, and you better check in the medical notes, but from my understanding, they needed to compare peripheral draw from a draw on the line, so they can compare location, something. They needed to compare the line with control before they could start a specific set of antibiotics. So that was the key thing.
Just pausing there. So step one was to get a comparison between blood on the line or blood drawn from the line and what you described as a control. And where was the control to come from?
A peripheral. So the junior doctors that came in went to the 4 extremities to try and get blood. It was unsuccessful, to say the least. He ended up quite traumatised behind it, to be honest. And it goes back to the not being under the umbrella, not having the people that can do the job well. They were trainees. They did the job as well as they could under the circumstances. And I hasten to say, I don't denigrate what they were doing and their skills, but they weren't up to. They didn't have the skill base to be able to draw blood. So discussing it later, latterly, from what I understand, rather than I talked about earlier on about looking at the hand and really investigating to say, okay, well, if that's my plan A, that's my plan B, knowing areas where they can go and find blood. It wasn't easy because he was not well, so it wasn't an easy draw. Kind of just slapped on the EMLA on all of his extremities, came back in half an hour to start trying getting blood. And it was just a nightmare. And post-event, he was quite traumatised by it.
But just pausing there, I mean, you described it, they're really effectively 2 discrete bits to the investigation. There's the drawing of blood from the line. Then you described that they put on this EMLA
Yep.
cream, and you just talked about that earlier. That's effectively a painkiller
Yeah, yeah.
of some kind. And then they go away and they come back. Apart from the issue and the difficulty in taking blood, was there another issue was emerging by this stage?
With this point, they had exactly timelines, and it was within the space of about 2 hours. So exactly the time I went on, it's 10 hours before or after, it would have been after the draw. They accessed the line to take the blood to compare with the blood, makes sense, and he started to deteriorate. It happened after he started to radically deteriorate after they tried to access line from his hand. Blood from his hand, started shaking, going into rigor, throwing up. Now, we wondered how much of that was a reaction to being poked at in 4 different places and being unwell, and all the itchiness because he was hunched up and being sick, which is not great to see when, you know, he's got a scar from smiley face across the whole of his belly, and that's an open wound. He's hunched up, being sick. So there's an awful lot going on then, but they still hadn't managed to get the blood from his hand to start the antibiotics. But yeah, so that was going on, and we started at that point to raise concerns that this isn't great. By 45 minutes between, clock the time exactly, 45 minutes from them accessing the line to we had a serious condition, and that scared me because I didn't realise that he could deteriorate so quickly, because after 45 minutes in, he was heart rate all over the place, temperature, vomiting. Yeah, that wasn't a fun period.
Yeah, so if we just to try and understand the timeline on that, and I appreciate it'd be hard to remember
Yeah,
the detail of it, and maybe quite hard to speak about it as well, I imagine. But there was an attempt, or rather blood was taken from the line.
Yep.
And the EMLA cream was put on at that point, and then John's left alone, is that right?
Yeah, there was a period where he was left alone.
And there was rapid deterioration from that point.
As soon as his line was accessed, click. And then 45 minutes later, he was in a state, and he was deteriorating through that period.
Yeah, and who was there at the point that he began to deteriorate?
We were in, I had, myself and my wife had to go and raise alarms with nurses and doctors.
Yeah, how did you do that?
Went to the room, ended up going through to the room.
Did you do anything before that? Did you press a buzzer?
I think we did press the buzzer to come through.
But did anybody come?
Well, the issue was, if I remember rightly, that one was a lunchtime, so it was difficult to get people on, you know, we had issues getting people.
Okay, so the picture we should understand is that after accessing of the line, during the 45 minutes of rapid deterioration, there was no clinician present in the room.
No, well, I can remember.
Yeah, and when they returned, when clinicians returned to the room, say it was 2 junior doctors.
2 junior doctors, they dealt with it initially before raising it, and it was accelerated up the chain of the.
And we'll get to that in a minute, but their response was to try and take blood from his hands and feet at that point, is that right?
I think so, yeah.
Yeah, and how many attempts?
Oh, they tried each, so it was at least 4 attempts, so on each sticky out bit, so they tried one hand, then the other, then the foot, then the foot. I can't remember whether they tried at least once. They might have tried 2 or 3 times on the same bit, going for a different vein, but certainly they tried on each extremity at least once.
And was that in itself something that was causing John distress?
Oh, absolutely. And we wondered whether, not knowing what a temperature spike was, we wondered whether his reaction was, we underplayed initially because it was part of that getting worse, his deterioration curve. We wondered how much of that, at that point, before it got down to here, how much of that progression was reacting to the getting jabbed 4 or 5 times and that experience, was he reacting? It transpires maybe it wasn't, but, you know, we didn't know along the curve that it was going to, we didn't expect it to carry on down there. So certainly he was
When you say
very...
carry on down there, what you mean by that?
He deteriorating, you know, this was when you go in with your child, when your child is told they had cancer, the moment they tell you, or before they tell you, your child's dead until people start intervening. Before the doctors and nurses start intervening, your child is dead child walking. But when they start their work, the odds work, and I tend to deal in numbers. It's the way I kept my sanity throughout this. So through the work of the doctors and nurses, they changed a 0 survivorship to a 90% survivorship, and that's great. You know, 90% survivorship, but that's still, and in fact, by the end of it, we were looking at a 95% survivorship, 5 years survivorship, which is good for cancer kids. You know, that still too many. Still one person in this room is going to die of cancer. And that's better rather than 2 people in the room dying of cancer. But, because we've got about 20 people in the room. But it's you want to stay away. You want to stay out those scary numbers, those you stay out the red, stay in the black. That was it. And that was when I felt he went from the black into the red. He was circling his drain. His blood rate his heart rate was above 200. The room, by the end of it, was full. John actually said it. I asked him about it. Can you remember this process? Yeah, I remember seeing 7 doctors in the room at one stage, Daddy. And not just trainees, you know, top end. People just kept on arriving. And when you see fear in doctors' eyes, fear of the intelligent people, not the trainees, but the really intelligent people, that sucks. That's scary. That for me was that was difficult to cope with, and we had kind of steeled ourselves for dealing with cancer and the implications of cancer. What we didn't expect was to be put in a position where building almost killed our son, and that's really, put it brutally, hospital-acquired infection was the point we came closest to losing our son. And in hindsight, we had a conversation about this, and I try and keep things light, and you probably picked this up from this point. I try and look for the positive side, and a sort of debrief I'd flagged the doctors, and like, well, it was only a line infection. It's not, you know, compared to what had happened with the cancer and getting kidney removed, it was only a line infection. And the doctors were like, no, actually, this was the scariest. This was the thing we are most concerned about. And that to me, put the fear of God in me, because, you know, it's my son's just had his kidney out. He's just had treatment for chemotherapy. He's just had treatment for cancer. And the most concerning thing about this weekend is a line infection. Now, you know, I found that quite difficult to compute. And that really put a rocket up my bahookie, for lack of a better phrase, because if that's how dangerous a line infection can be, you always have to be on point. You have to make sure every time you go into that room, it's perfect, because I don't want to get a line infection again. You know, you've got to make sure anytime any doctor or nurse access the line, they follow the protocols. So I felt an awful lot of responsibility to make sure that, not that I knew what I was doing, but because, and the way I dealt with that was saying, you know, if this happens again and it doesn't go well, if this goes unsuccessfully, if John moves into you know, if we lose John to a line infection, I need to be able to say to myself, I did everything. These are the things you think about at 3 o'clock in the morning when your son's spiking. I need to be able to say to myself, I've done everything, and that means I need to be on it. But yeah, but it wasn't fun.
These are things that you thought about subsequently.
Yeah,
and
yeah.
You already alluded to the meeting, and we'll come to that. And I don't think anyone would be in any doubt, having heard your evidence today, Mr. Gough, that you truly are somebody who has a glass that is at least half full.
Mm-hmm.
I want to think, though, about time as it actually happened. I mean, did you think I could be losing John here?
The second time it happened, I think the first time I was kind of not aware of it happening. It was like watching something on slow motion. Things were happening so quickly that you were catching up with it. So you were always about 5 minutes behind. So kind of caught up with it after it had happened, but there was a huge panic when your son's heart rate is sitting above 200 consistently, when the machine has been silenced and needs to keep on being silenced because it's set the maximum that you can turn the alarm up to disengage the alarm is 150 beats per minute, and John's heart rate is above that the whole time. We're sitting at 200, whereas temperature's through the roof, and he is. Yeah, it's not fun. It wasn't fun seeing him like that, and yeah, it wasn't fun. We don't want that to happen again, and I hope it doesn't happen to anyone else again. And yeah,
but it did happen again.
Yeah,
didn't it?
yeah, and that was, I suppose, the second time, and yeah, it wasn't the. I was amazed how quickly it went wrong.
Well, let's look at that second time.
Yeah.
And in fact, it was the very next day, I think. Mm-hmm. And I think by now, the advice that was coming from the microbiologist, according to your statement, is that an antibiotic block put on the line.
Uh-huh.
I think, did you actually have a discussion with the senior clinician about when would not be the ideal time to do that?
Dr. Hettle, who was fantastic, who calmed the room the first time. And when Dr. Hettle came in on the first thing, as did Jenny, the nurse, fantastic. Really calmed the room. He was great, just and had a calming influence on the room. When we discussed it, he managed to get blood out of John, but was very much, just start the antibiotic, get it on, get it started, get it working. When we discussed it, it was suggesting when they put the block in, and I'd said, well, let's not do it on Friday afternoon, because we struggled to get people here on lunchtime, and Friday afternoon you've all got to go home, and I wouldn't want to detain you and you're getting home, so let's not put it on a Friday afternoon. Shall we avoid 4:30? And I sort of jovially, but let's not. And he was very much, oh no, let's not do it on a Friday afternoon at 4 o'clock. So they did it on a Friday afternoon at 4 o'clock. And that became a problem because Friday afternoon on a 4 o'clock, quite rightly, people are going home because it's Friday afternoon at 4 o'clock. So again, there was issues about getting people on site that could deal with it.
Deal with what would become a crisis.
Yeah.
Well, let's not go immediately to the crisis.
Certainly.
Let's first of all understand what it was that was happening. Is it a flushing out of the line in some way?
So what do you mean?
The antibiotic block on the line. What exactly is that?
From what I understand, it is it's sticks bleach in a pipe, bleach in a straw. Your Wiggly's a straw, fill it full of bleach. It's not bleach, I hasten to say, so hope it's not bleach. But put this stuff in that kills the bugs that are in the line. The issue with this bug in particular, John's bug, was it's a poo bug, but it's a sticky bug, which means it's difficult to get out of plastic. It's a bit like when you put spaghetti in Tupperware and you wash it out and you get that red greasy stain, and that was the way it was described to us. It gets into the thing, so it's difficult to get out. But yeah, that was...
Yeah, and so I understand from your statement that the process of giving John this the antibiotic block on his line caused something called a toxic shower.
Yeah, so in accessing the line, you've got this tube nastiness, or a tube of this tube had been put out of bounds. There's stuff in here, and in just moving it, pushed out nasty stuff into the system, and it just, as you say, showered the system with all the bugs that they were trying not to, and within 40 to 45 minutes, to the minute, all hell broke loose again.
And so what does all hell breaking loose comprise? We
had temperatures all over the place, heart rate through the roof, rigor, yeah, circling the drain. You know, that moving out 90%, moving into the 10%. And that was him, from conversations afterwards, that was the scary bit. That was
on this occasion, having been through it before,
yeah.
Mr. Gough, that you're thinking at the time too, this could be it.
And yeah, it's not fun to...
What did you do?
I held his hand and hopefully... What else can you do? Yeah, it wasn't fun. All you can do is hope, and hope that the right person comes into the room. And there were, you know, Dr. Heddle came in. When Dr. Heddle arrived, I was happy. He was my saviour. I'm happy you're here. Go and do what you have to do. You did it last time. You did it this time. And everyone was trying what they could, but yeah, it wasn't great. And getting people there, getting the experts there, and getting people there that were used to dealing with line infections. You know, we had Jane and, apologies, the two senior nurses eventually came over, only because it took a bit of time for it to filter from the new Schiehallion, came across, so that's down 6 flights of stairs, across and up to... And out of breath because it had run, and they came over, who are experts in dealing with line infections. So it was great to see them as well at that point, and they could lend their expertise. And good to see a Schiehallion face there at that point, because
a bit of the Schiehallion umbrella arrived.
Yeah, and the people that were there did what they could, but fundamentally we started off in a situation where there wasn't enough people who are expert enough to deal with it, and that was probably the timing really didn't help.
And I think in your statement you indicated it took about 90 minutes to stabilise.
Yeah. Which that was a long 90 minutes. That was a long 90 minutes. Yeah, that wasn't fun, and for either of us, myself or it's. You have throughout the process, going to sound weird, you've got to make cancer fun. I know that sounds the weirdest thing. You can't live in a negative, toxic, because it's going to be at least 9 months, maybe, you know, for some people 3 years of their life is doing this. So you've got to make that journey, for lack of a better phrase, as enjoyable as possible for both you and the child, because, you know, it's if you're happy, it's easier to deal with. And there are points of this that we do look back with fondness, but there's points of it we look back at that wake you in the middle of the night. And that this is one of the bits for me. This was one of the key bits that I look back and go, and I would have said this point impacted me more, had more of an effect on me than when I was told my child had cancer.
I want to then move on a wee bit to think about your reflections on these incidents. I mean, it's implicit in what you've said, but did you feel that John was under the protection of the Schiehallion umbrella during these incidents?
No. I think that he had some very good doctors and nurses, but dealing with line infections, which was Schiehallions, thing. We didn't have them there, and it would have been, having Schiehallion there, I feel would have been, they would have been much quicker at picking up infection because they deal with it on a daily basis.
When did you discover that it was a line infection?
We were told the day of the operation, I think the day after. Certainly, he came out of ICU and he'd had a temperature spike in ICU, and that was confirmed as a line infection. I think, can't remember when we were identified exactly what the infection was. I can't remember whether it was during the week or at a meeting we had at the weekend, but in that period of 5 days, we were told at some point throughout that process exactly what the infection was. Certainly, we were told on the first day.
I think, according to your statement, initially the indication from one of the clinicians was it was a poo bug.
Yes.
And then later, at some point, you learned the Latin name for it.
Yeah.
Serratia marcescens.
I'm glad you did that one.
Yeah, well, you saw I had to check my notes.
Yeah, well done you.
Yeah. You mentioned that you had a meeting when there was a discussion about the infection, and I think you met with two senior clinicians, one the oncologist, in fact, who was in charge of John's care,
Yeah.
and you also met with a microbiologist, I think?
Yes.
And I think the way you put it in your statement is that, again, you were maybe looking for the glass half full aspect on this, that the cancer's the problem. But
Yeah.
they indicated to you that, in fact, no, it was the
Infection. Yeah, and that was the point, that was the nail in the coffin for me of the fear of God about line infections. Was, we've seen them, we went through it, and now they're telling us this is the worst thing. So yeah, that wasn't.
At that point, were you told where the infection had come from?
Yeah, we were told it was a hospital.
And were you told that there may have been other children who'd been affected by this particular infection?
We were made aware, whether it was specifically that, it might have been that. I think it was that day that there were people there were children being affected by it. I can't remember the exact date, but we were certainly aware that. I don't know, I lose track.
And at that point, you reflected on what had happened and what you'd been told and what you'd seen. How did you feel?
My son wasn't dead. That's all I cared about at the time. That really, immediately after, we were shell-shocked. All we cared about in the immediate vicinity afterwards was, our son isn't dead. Nearly lost our son. Our son isn't dead. That's good. And that was the sort of my knee-jerk reaction, being half full rather than half empty. Very quickly it turned from that to it reduced. No, it shot my confidence in the hospital an awful lot. Not to Schiehallion, but to a lot of the other places, and I felt a lot of responsibility at that point to make sure that I was doing everything to make.
Why did you feel responsible?
Because because I need to be able to look myself in the eye if he dies and say, I did everything I could.
And what did you wonder whether you had?
I think I wasn't aware at that point, but I think I'm a planner. Hence the reason why crash bag. I'm a planner, and the only way, that's what I do. I plan. I make sure you cover all bases and do your best to reduce risks. Stay out that 5%. Stay out the 10%.
Yeah.
And that's what I do. And I don't deal with the 90%. I don't deal with the 95%. The doctors and nurses do an incredible job and save my son. But there's a very, very small percentage there that we might influence. I don't necessarily say we do, but we might influence. And if this goes bad, then you need to be able to look yourself in the eye and say, well, I did everything I could to make sure that I was doing my job properly. And so therefore it put responsibility on us to make sure we were doing everything.
And did you ever have any concern at that point that maybe you hadn't? Was there anything that...
I think when they were talking about poo bug, you immediately assume, you don't think a hospital poisons your child. You don't, nah, hospitals are state-of-the-art hospitals. This is a state-of-the-art hospital. This is designed by intelligent people. Costs millions of pounds. This doesn't make our children ill. Must have been something I've done. And that you immediately assume. I'm not, and I hasten to say, I've got a clean house, but hospital doesn't happen in a hospital. So it's everyone's reaction. You know, if someone said, you know, this has been, you immediately assume that it's your fault. So that wasn't great. Yeah. So, and that kind of, I don't want to. It's difficult to put into words. It wasn't, knowing it was a poo bug, I think, was a bit of a shocker. When they told us it was a hospital-acquired infection, there was a small bit of us that were like, well, at least it wasn't our fault, which was good. On the other hand, my goodness, the hospital? This is a hospital, you know, supposed to keep our kids safe. Surely someone has designed and built a hospital that is not fit for purpose. The purpose of a hospital is to provide a safe environment for your children and adults to be cared for. Someone can put a drain in that drains uphill, or an air conditioning unit that doesn't work properly, then that isn't fit for purpose. It's poisoning our children, and that's not great, to be honest. So we have to do everything we can to mitigate that, and yeah, but it wasn't great. But
okay, we move on a little then in the timeline, Mr. Gough. One of the things I think that had happened as a consequence of the line infection was that John's line was removed. Is that right? And the other thing maybe to pick up on is just the outcome of the operation. I think I understand from your statement that the chemotherapy had actually killed the tumour completely.
Which was great.
So, but there was nothing to biopsy, is that right?
Nothing to biopsy, yeah. So we ended up having to, because of that, going for, they continued on with chemotherapy because he was an unknown quantity, so you're better off giving it a chemical disinfectant was the way of, you know, cleaning out with chemo just in case. And so that commenced soon afterwards, I think. And for that purpose, was John admitted again, this time I think toward 1A, the Children's Hospital, to have a port fitted? Yes, yes. Now, you indicated that I should ask you about what a port is, and now I'm going to do that. What is a port? Port is a bit different to a wiggly. It's the best way I can describe it is, you know those badges you get, which you squeeze the back? There's got a pin that sticks in. You squeeze badges that you squeeze and you can put through the front. Well, it's a bit like that, but the badgy bit sticks here and connects a line into your system. And the sticky in bit, technical phrase, good one there, sticky in bit, is attached to a line. So this sticks in here, it's buried beneath the skin. And the advantage of this bit underneath here is that because it's covered up, it's less likely to get an infection, so you can do a lot more with this. The difficulty is you need to access it through the skin, so you need to punch through the skin, hit this disc that's below the skin. So that's what John had. And I think that took place on the 26th of September. And by that stage, I think wards 2A and 2B of the Schiehallion unit were in fact closed. The Schiehallion unit had been moved ward 6A in the adult hospital. And so I think John was transferred to ward 6A. Yes. And I think, according to the timeline, he was eventually discharged on the 27th of September in order to have his treatment again as an outpatient. Is that right? Yep. So would that mean that his daycare treatment as an outpatient would be in ward 6A of the adult hospital? Yes. At the meeting that you'd had with John's oncologist and with the microbiologist on the 17th of September, had you been told much about the move to the hospital, to ward 6A? There wasn't a lot of information at that point. Very, very little
What was
information.
this of course wouldn't be the last move, as it were. What was your overall impression of the hospital's approach to the apparent need to close wards and move patients elsewhere?
It was a knee-jerk reaction, quite rightly so, because they were dealing with a ward that was dangerous, moving into a ward that you hope was slightly less dangerous. Hindsight, there wasn't a huge amount of planning with regards to. I don't think anyone expected it to take as long as it did. They didn't expect it. We'll be home for Christmas. They didn't expect there to still be in. Well, it still hasn't moved back yet, and I think the way it was set up was this is just a short term to get them back into Cuddihy as quickly as possible. Which you kind of think if it was going to be a short, sharp, jump in, jump out again, then actually we can work, we can muddle through for a month or two, not for a year or two or three.
In your statement, I think you describe it as being kind of make do and mend approach.
Yeah, very much so.
Even I think at one stage described as a Heath Robinson approach.
Yeah. It's fundamentally you've lost 2 wards of a hospital, and you've got to make space somewhere to accommodate these children.
Yeah.
So whatever you're doing, someone's put out.
Yeah. But from what you saw, at least, you didn't see any evidence of there being any kind of plan.
No. It was. There's a space. Shove them in. Let's just get a space for these kids, and there was no obvious strategy about creating a space and environment that was suitable to all the needs required, not just the accommodation. So it wasn't just there were rooms, but there was not the whole gambit of stuff that was required.
I want to move on now, Mr. Gough, and ask you about your experiences and John's experiences on Ward 6A. And I think one thing you emphasise in your statement here is that the Cuddihy staff, they moved there too.
Yeah.
So I take from that bit of the Cuddihy umbrella went with you.
Yes.
But what about the infrastructure?
You went from having areas that you could congregate, both as children congregate and adults congregating. So you went from having playrooms, teenage playrooms, and tea rooms, for lack of a better phrase, to nothing. You went from there to being in source, into isolation, because there was no space for anyone to chat, interact. You had your room, you couldn't go to other people's rooms, so you could really speak in the corridor, and that was it. And you didn't really want to congregate in the corridor, because that was a thoroughfare, as you'd identified from the drawings. Actually, we haven't seen those yet. Cuddihy, the daycare was at the end of the ward, so people had to walk through to get daycare. Therefore, you didn't really want to congregate in the passageway, so you were in isolation.
Well, you've alluded to the drawings, and I think we'll now look at those. So Miss Callahan, who's helping us this afternoon on that. So I wonder, Miss Callahan, if we could go to bundle 2, please, and to page 41. Thanks very much. Although it's buffering slightly, I think we could probably work with it. Again, I don't think we need to look at it too closely. I think we're seeing one of the points of the star there in the adult hospital, is that right?
Yes.
And I think that's the title. This is a floor plan of Ward 6A, is that right? Is that right?
Yes, sorry.
Yeah. And I wonder if you can just help us a bit with some aspects of this. Where is the entrance and where is the exit?
So entrance and exit was both, if you go to the left-hand side, if you look for the phrase atrium void, go upper left and corridor there, and that's where the entrance and exit is.
And in terms of play area, where was that?
There wasn't. So they had attempted to sort of if you walk down that corridor, so you come from the entrance, and there's a set of rooms on your left-hand side if you're walking along there, and then a wall, and you would come to a nurse's station. So occasionally they would put a table to do activities, maybe, but any activities that were done had to be done generally in the rooms because there was no space specifically for children to go and play.
And I think you've already indicated that, and sorry, when I asked you about play area, I take from what you said that there was no playroom as such.
No.
And whereabouts was daycare then?
If you look at that image, there's an F6 to F14. You imagine a line joining those two, or possibly F5 to F13. I can't remember exactly where the split was, but somewhere between the two of those is where there was.
So if we go onto the fin, as it were, about halfway along there, you would more or less just a bit over halfway. You would reach daycare. Is that right?
Yeah.
And to get there, as you've indicated, you would have to walk through inpatient care.
Yeah.
Is that right? Ms. Callahan, could we go on to page 42, please, and scroll down and have a look at some of these photographs? Thank you. By all means, Mr. Gough, you take me to any particular photographs you were going to, that you helpful to look at. There were four I thought I would just mention. The top left-hand corner, we see a typical view into an adult ensuite bedroom. Is that the sort of bedroom?
Aye. Not far off. What to flag on that is there's no folding. So you're on a Z bed. Which.
And if we go just in the same column, a couple of photographs down, we see a bathroom. Is that the layout of the ensuite bathrooms there?
Yeah.
Then in the top right-hand corner, we see level 6 lifts.
Yes.
And was that the same as Schiehallion? Were these designated lifts?
No, I think sure when COVID kicked off, they designated the left-hand one, but getting up to Schiehallion, New Schiehallion, 6A, was a nightmare on the lifts because that served that whole end, and getting in and out of those lifts was a nightmare.
So were these lifts that served the whole of the adult hospital?
Yeah.
And
busy, very busy.
With all sorts of patients, all sorts of people?
Yep. All the snots and grots and all the lovely things which is fair enough. It's a hospital. That's what they're supposed to have there, but not near my child, please.
Yeah, how did you feel about taking an immunocompromised child in there? Not
great. I did weigh up, and if it had been my daughter's, I would have carried it up the stairs, but I couldn't. Thankfully, John managed to hold on to some weight, so I couldn't have got him up the stairs. But if it had been my younger ones, I would have just carried her up the 6 layers, 12 flights of stairs, and to avoid that.
And below that picture, there's a last picture I was going to look at, last photo I would look at, is something that's described as typical adult ward socialisation space. Was there a room like that on?
Yes, that's a very good photo. I wish that person photographed my house because it makes it look an awful lot bigger than it is. That was the room at the end that was used for the daycare waiting room. So left-hand side where you see the circular table, there was a reception desk, and then you had chairs waiting around there. So that was everything. So in the old Schiehallion daycare, the old daycare, the reception desk was away from the waiting room, which was quite handy because you didn't have to air your washing in quite such a public place. Whereas that, and to be honest, the receptionists were fantastic. So you never felt in a position that you had your washing aired, but it wasn't easy for them to work in the environment. Also in there, you had because it was such a cramped space. Initially, they had all the lockers for the nurses as well in there, because the nurses didn't have any space either. So yeah, lots of space being used.
Thank you very much, Ms. Callaghan. We could put these to one side. I mean, when you were on Ward 6A, was there the same interaction with parents that there had been?
Absolutely not.
Why was that?
Because you couldn't leave your room. Well, you could, but there was nowhere that you could meet other parents short of in the corridor, which had the issues of being a thoroughfare. So because you couldn't go into each other's rooms, there was nowhere for the kids to.
The people just tend to stay in their rooms.
And to be honest, we were so happy that we got diagnosed before the move, because we got the 4 weeks of having the input from the other parents. You know, and I'm describing the looks of the mothers in the room. I couldn't have done this journey without those people at the start. And it was made a lot more difficult not having those people throughout the process. And I feel so much for parents going in there and children going in there. And actually, we don't matter as parents. Really, it doesn't matter. But our kids become only children because they don't get to socialise. Because they can't socialise with kids in the real world because they're immunocompromised. So we can't let them go and play in a play park. Can't let them go and play with anyone else. So you can let them play with their brothers and sisters as long as everyone's in a bubble. We all know about bubbles then now, but no one knew about bubbles there. But when you had Schiehallion set up as it was, socialise in Schiehallion. Your children could have normal childhoods rather than being. There's nothing wrong with being an only child, but that's what your child became. Child.
What was the impact on John?
John did very well, a lot better than that we did as parents. And we did an awful lot of work trying to maintain socialising with him. But it was tough. He did, you know, he became an only child, and socialising with people of his own age was difficult. And we did an awful lot of work with him to try and get him back into reality, get him back to knowing how to sort of not being in adult company all the time, and not being the only thing you talked about was cancer. Cancer. And he very much became defined by his illness by the end of it. And that's fine, because he survived. That's all that mattered. But John is a fantastic child who has so much to offer. He isn't just a cancer survivor. He is a boy that likes Lego. He's a boy that likes doing so many other things. He is not just cancer. And when you keep kids in isolation like that, that's all they become is cancer kids. And that's not fair.
Moving on then, I think John continued with his treatment as a daycare patient. Mm-hmm. Moving into November, December 2018. And I think, see from your statement that he experienced a temperature spike on the 13th of November, and he required to be admitted, but there was no bed space in 6A. And on this occasion, he was admitted to the cardiology unit in the Children's Hospital, which I think is Ward 1E. You have it as 2E.
I lose track. My apologies.
It may not matter.
So many E's and C's and D's.
Indeed. So that was an admission to the Children's Hospital, but not under the immediate care of the Schiehallion nurses and doctors. But I think, indicating your statement, I think you've done so already today as well, you are complimentary of the care that John received in cardiology.
Cardio are great.
And you then describe another temperature spike and another admission, this time at the beginning of December, 7th of December 2018. And again, there was no bed space in Ward 6A. And on this occasion, John was admitted to Ward 3C.
Yes.
And that's the orthopaedic ward in the Children's Hospital. Is that right?
Yes.
So I want to ask you a bit about that.
Sure.
Once again, John's in a part of the hospital where he's not under the direct management and care of the Cuddihy and doctors and nurses, is that right?
Yeah.
Did you see, was there anything that occurred right at the start of that visit that made you wonder about that?
Going in, we went in through A&E. There was issues accessing his line, and he had to lie in a specific way to get in, and he struggled to find his line to the extent they ended up going on a peripheral line rather than putting meds in here. Now, at that point, my hackles were up. Hackles are up, that's the phrase. My anxiety was up because is there a reason why we can't access? Why is that not accessible? Because admittedly, we're slightly different people trying to do it, but why couldn't that be? Is there a problem here? Is this compromised? It's got a spike. Can he get into that? Is this compromised? Is there a blockage? We don't know, because it had been accessed, I think, a day or two beforehand, because he'd just got his chemo. So what's the issue here? So I'm up here already.
And when you're indicating here, that's his port.
Yeah, that's his port. So
and so the staff were unable to access the port.
Yes. So we're already anxiety level 7 because there's an issue there. We haven't worked out what it is, and also with John, if they missed it, because obviously they're trying to hit something below the surface, if they didn't get it in the right place, he would squeak because it was sore, and they hit it and it still didn't go in, so they probably just didn't go in the angle, but he didn't squeak, so they were getting in the right area. It wasn't a mechanical thing. They're all the stuff you pick up when you pay attention to these things. So right area, just not being able to draw, push through. So we were concerned about there. Didn't have space on Cuddihy, so we were moved to ortho. Now, admittedly, ortho it deals with a different type of illness, different, a different rate of, you're not going to, it's unlikely you'll deteriorate very quickly if you've got a broken arm. As bad as that broken arm is, and I'm not in any way, shape or form undermining some of the incredible work that ortho does, but it's a different type of work. And we certainly noticed there that there was not the responsiveness to the changing situation that there should have been. Whether that was, let's just assume that was a lack of training and lack of experience dealing with it. But certainly we came out of that feeling very concerned about it, because fundamentally we were treating John with a line infection, and some of the indicators that were being flagged up showed that this was probably more likely to be a line infection than previous visits, and it wasn't being treated with the appropriate gravitas that it should be.
Maybe something I should have asked you about earlier, in fact, that when there's a temperature spike, there's a protocol effectively that says we'll proceed on the basis that this could be an infection, and a line infection in particular. Come to hospital. You have 48 hours of being monitored.
You come to hospital, you need, so the moment his temperature goes above 38 degrees C, you go to hospital. If you cannot get to hospital within 45 minutes, you phone an ambulance. And that's, if you can't get there, you phone an ambulance and the ambulance gets you there as quickly as they can, because they are dealing with it, we are all dealing with it as a line infection. So that's the way we treat it.
Yeah. And so when you're in the orthopaedic ward against that background,
yes,
and against the background of what you saw and experienced in September, were the alarm bells ringing? Oh,
phenomenally. 3 observations in 24 hours. Could have been dead between obs.
What do you mean by 3 observations?
3 measuring his temperatures.
As in that's how often it happened?
That was it in total. 24 hours is 3 times. And now we always carry thermometers, so we were measuring him as well, and I was keeping a track on it. Not being paranoid parents, but it's you got to and I suspect most parents of kids that can tell their temperatures, tell the temperature of their child within a couple of points of a degree, not even in a thermometer. But you always carried your own thermometers. But yeah, 3 obs and having to chase medication. That was the other concern we had, was there wasn't okay, John's out of meds, he's 4 hours out, he is going through Riga, he is deteriorating, we need to deal with this. Now, if I had told a Schahalian nurse or doctor this, all hell would have broke loose. I then had to go through again and rattle cages, and I don't like rattling cages, I'm not that type of person really. And then again, so it was, people weren't aware, and given the devil the due, people weren't aware of the implications of not dealing with this rapidly. And thankfully, that wasn't a bad infection, that wasn't a line infection, so we got away with it. But might not have gotten away with it if, let's not go down that route.
At the start, when there was the issue about getting access to John's port, do you remember doing something in response to that?
Yeah, we ended up getting a line into his hand.
Do you remember yourself doing something with John?
Oh yes, sorry. With John had post getting all the needles in him when he had his first couple of spikes. When he had his reaction, he didn't mentally react well to being used like a pincushion. So became very needle averse, which is not surprising considering it was a painful stimulus when he was at his lowest. So we got to a stage where getting John to get needles into him wasn't easy. Now, luckily, his port was relatively easy. But anytime you got a thumb prick, and before you got meds, you got a thumb prick, even getting a thumb prick, it wasn't easy. So John and John was great because you could, and is great because you can rationalise. So we had a lot of conversation with it, and we worked out a strategy of how John could be stabilised so that he could get bloods. And by stabilised, I mean restrained. Let's not beat around the bush. So it's John and I, we worked on it together in a jovial way, as you do, a jovial way of how to restrain your child. It's where he would sit across my lap, would put his head there and his arms there, and I'd hold on for grim death. And in that banana position, you could put out his arm and his hand, and it was safe, and we worked out together. Okay, is this sore for you, John? Is this okay? Okay, can you move, John? Are you comfortable here? Yes, that's fine. We practiced before we went in for the next, before this had happened. But yeah, we were at the stage of the play team did an awful lot with work with John subsequently to try and get him through this because he needed to get needles done. But in the interim, we worked out a strategy of where he found a way that he could be held comfortably that would stop him flapping around which is a bit sucky, No one wants to have to pin your child to stick a needle in them. That was one of the more. Again, you look back at the good days and bad days, and that was one of those days you look back and go.
And I take it from what you're saying that wasn't a feature of John's behaviour, as it were, when he first undergoing.
Oh, absolutely not. John was phenomenal with how well he dealt with. I don't know how he did it. He just bounced in and was always a smile, and the incidences or the stuff on that day when he got the line infection kind of dented his confidence in a lot of areas, which is fair enough. That's not surprising, but he kind of knocked the wind out of his sails quite a lot, and particularly with needles, which it was just another thing we had to deal with. And I know that sounds a bit rough, but okay, I've got to get John into hospital, and now I need to get him into a state where he is in a happy. And we always bounced in. We always did bounce in, but to the extent that now when he goes to hospital, he likes going in and visiting. But it's just you know, it was so much easier when we didn't have to think, okay, let's do all the stuff that we, you know, put in protocols to make him be able to have a JAG, because he was so JAG adverse.
Finally, just still in relation to this particular visit to Ward 2C, was there a point where you physically took John 6A?
Yeah, we got, couldn't get a line in, and eventually 6A there was, but they needed a line in, and eventually someone was like, I can't remember the process of conversation, but it was decided that we to go and try 6A to get a line and see if the experts could get a line into John's, into the port.
How did you get there?
Oh, we took a wheelchair. So that was great, because the moment they said, okay, we could take you over to 6A, I went, aye, fine. I went and found a wheelchair because I wasn't hanging around, threw him in the wheelchair, and we just dashed across the hospital, because I was like, they made the decision. I have permission to take him, and we dashed across, and there was no problem. Literally threw it from the other side of the room. Poof, job done. Not quite, but the nurse in question just not an issue at all. And it was the fact that the people that tried didn't have the experience of the Schiehallion to put it in, and that wouldn't have stopped the problems of not responding to the limited number of observations. It wouldn't have stopped the poor response time to dealing with situations, but I certainly would have been a lot calmer knowing that they'd got a needle in, because while people were unable to access that, there was a doubt about that. The moment someone could get in and it was working, then that was like, no, you know, it's not blocked. There's nothing physically stopping that there. So certainly for me, I don't know whether that was. I was up to 90 until that line was in. When that line was in, I could breathe out a bit.
Hence the trip to 6A.
Yeah.
And you put John in a wheelchair. You didn't carry him.
No, actually, put him on my back. Might have collie bucketed him. No, that was collie bucket. There was
Yeah. If I help you a bit here, Mr. Gough, I think it's appropriate to do this. Then Mrs. Gough's statement, she indicates that there was an incident where you literally put John on your back and ran.
Yep. No, he was collie bucketed that time. I lose track. To be honest, he was wheeled about the wheelchair an awful lot that time. So,
right.
But I do remember going, forget it. Let's go as quickly as we can. That wasn't what I said in my head, but my attitude was, let's just go hell for leather. We've got a pass. I'm going, and we scooted, and he loved it. Yes, remember that, because he thought, this is great. I'm on Daddy's back. Great fun, and that's what you do. You make it fun, you know, and it changes a scary situation into, I got a collie bucket from Daddy across the hospital. Can we do that again, Dad? No, I need a chiropractor.
But it was a scary situation.
Oh, phenomenally. You know, you laugh on the outside.
Yeah, but you must have been thinking, here we go again.
Absolutely. The moment they couldn't get a line, I was back there waiting. And without the support, any form of support, you were on an island there. You were cast adrift.
And so the response is, go back to Schiehallion.
Oh, and you know, again, you're with Schiehallion, and we got to the stage there where, maybe to give it a degree of perspective, just before Christmas, and the nature of his cycles of treatment were, it was possible that we were going to end up over Christmas. And myself and my wife's conversation was, well, I hope we don't end up in hospital for Christmas, because that would suck. We don't end up in Christmas. After going to ortho, the conversation was, you know what, I don't care. Yeah, if we end up in hospital for Christmas. But we're coming to Schiehallion. You know, as long as we don't end up in ortho, we don't care. You know, and that's to the extent that we were having a laugh and giggle, saying, like, where's our bed? The last time we need, we'll just book this one in, and we'll just come in on Christmas Eve, and because, you know, that was how much to fear God, that place put up to us. It wasn't fun.
Now, we can see from your timeline that there were a number of further visits, in fact, over the Christmas period and January. I'm not going to ask you about all of those. I do want to ask you about admission in January 2019, because I think, as you indicate in your statement, in 2019, Ward 6A itself, in fact, eventually closed as well. And around about the same time, John required to be admitted. Now, for those following via Mr. Gough's statement, and I apologise for not doing this earlier, around about paragraph 247. What was the issue with Ward 6A, as you understood it at this point?
I think there had been flagged a fungal issue.
What do you mean, a fungal issue?
That there was a fungal issue, entirely sure. That there was a fungal issue on the ward, that airborne fungal issue. Something about pigeon poo.
An airborne fungal issue?
Yes, pigeon poo springs to mind. There was some communication, not a huge amount. I think my wife got a letter. With regards to dealing and managing the hospital experience, I tended to be the first wave that went in and dealt with a lot of the heavy lifting and getting things set up, whereas my wife's much more intelligent than I am, and she was very much better at that side. So, but from my understanding, there was a fungal issue, and they were putting in air filters to clear this up, HEPA air filters to purge the air. I think there were also some children that were getting some prophylactic antifungal meds. We were unable to, or we weren't given the antifungal meds because they would interact unfavourably with, I think, either the dactomycin or the Vinc. I think it's Vinc actually, that you couldn't give Vinc an antifungal, and where we were in the treatment, you deal with the most important thing. Most important thing is cancer for John. For other children it was different, and so it was decided that the protocol should continue on, but that was what was going on there. There was a move out the ward, do some work. I think the flooring, they were reassessing the flooring in Ward 6A because flooring wasn't great. I think there were some problems with seams, and they were wondering whether that was a potential place where the fungus was also growing within the toilets and such like. So we got the corners, and I remember one room when I came out, they'd cut out all the welding, and I think they'd re-welded some of the seams on the toilets, floors and such like. So just the process there, but it was about dealing with a fungus.
And your understanding was that some patients, I think children in particular, were being given a prophylactic medication? Yes. But John wasn't able to have that?
No.
How did you feel about that?
I found that was, I remember speaking to Gough at that point, and we always try and be very positive, because it doesn't, not in a sort of happy clappy, but it's easier to deal with, trying half full rather than half empty. It was it was the only time I became emotional in front of people. Obviously, we all become emotional, but when the next move happened, because it was just, what's happening now? Are we moving again? And I felt so sorry for the prof, because
the prof,
Professor, I forget the name.
Gibson.
Oh, yes. My apologies. I didn't call them prof to their face, but because here's a person that's having to go around people telling them about a situation which they have no control over. Having to manage this, manage a group of children and try and get these children better. And I felt just doing such an incredible job in such a difficult set of circumstances. But it was the only time I got really upset in front of people, because it's like, we're getting hit on all sides here. We can cope with our children having cancer. Not great. We can just about cope with it. But these things, we don't know where we're going to end up. We don't know, you know, am I going to end up in Schiehallion? Am I going to end up in a ward full of people that aren't trained to deal with this? We're going to end up in a ward that's safe. You know, it's just, for me, that was the straw that broke the proverbial camel's back, because I was just, I'm done, you know, and trying not to vent at Professor Gibson, because it wasn't her fault, and she was, heck, I'm only dealing with one child. They're dealing with a ward full of children. Their life is about keeping these children well, and the environment round about them is really hampering them. And what they achieve is incredible within that environment. Yeah, I was done. At that point, it was just another thing along the way. And I'm glad it was close to the end of the treatment, because I think another one of those would have kept on going, but we were all run down. We were all done after.
What's your assessment of the communication around this stage of things, the problems on Ward 6A, the requirement to move it, the issues with fungus? You've also mentioned something about pigeons.
Yeah.
I mean,
The communication wasn't great. Let's not beat around the book. It could have been an awful lot better. I felt that there was a lack of communication and long-term planning. That after the first month, well, this is where we are. Let's okay, you've got a month's grace that you can pretty much just cobble through. We're now 2, 3, 4, 5, 6, 7 months into this, and we haven't moved this further forward. It took a year to get a playroom. It took probably over a year to get a playroom. It took I bet you they don't have a tea hut anymore. You know, they still, there wasn't, the knee-jerk reaction gets you by for the first month. After that, and I'm allowed to, you can let it slide for a month or two, but after that, come on, you need to pull your socks off and start dealing with that. And you've got goodwill from all of us for the first month or two, and we can suffer it for the greater good for everyone for the first month or two, but after 3, 4, 5 months, we need to have a long-term strategy of how to deal with this. And I didn't feel that there was any form of long-term strategy. And it wasn't just for us, for the workers, for the play leaders that had to go down 3 flights of stairs, up 12 flights of stairs, and then back again to get a infrastructure and kit for the kids because they didn't have a room in Schiehallion. So there was no planning, I felt. And, well, not I felt, there was no planning.
and so anyway, just to complete the timeline then, Ward 6A was closed for a spell January. I think John moved to another part of the Children's Hospital, the clinical decision unit.
Yes.
I think it's known. And then just to maybe complete the timeline and the story, happily John's treatment concluded on the 4th of April.
Yes.
Is that right? And he had his port removed. And maybe we should just bring things up to date. How is John now?
Fine, absolutely great. Full of mischief. Still building Lego, but no, he's great. He's there's still bits. You know, there's still. We had a conversation with him before we came here today to say, A, to tell him about this, and B, to say, are you happy with this? Is there anything you want to say? Because really, this isn't my story. We just held his hand. He did the heavy lifting, and his attitude was, I wanted him to write it down, and he didn't because he was playing. It's fair enough, but he was like, I just wanted to say thank you to all the doctors and nurses for getting me better, which I thought, oh, that was great, you know, and that's he's doing really well. But there was a lot of work that had to happen, get him socialising again, and not just from us, but there's an awful lot of charities out there that have been phenomenally helpful, like Jack's Den, Callum's Cabin, Logan's Fund, Abbey Sparkles, you know, all these people that really are about putting families back together again. And it's not an easy process for anyone. I'm not going to deny it, but I think there was an awful lot of stuff that happened because of the building and how the building was dealt with that made that journey so much harder than it should have been. And really that was not, and for him, doesn't matter on us, but for him, yeah. And he's doing well considering he went through all that extra stuff that he shouldn't have had to.
Thank you, Mr. Gough. Mr. Gough, we're moving towards the conclusion of your evidence. I've still got a little way to go. Lord, I wonder if it might be appropriate just to have a very brief break at this point, if that was
Sounds
suitable.
great.
10 minutes or?
Yeah, 10 minutes should be fine.
10 minutes, right. I wonder if Mr. Gough could be shown the door, as it were, before. Mr. Duncan.
Thank you, my lord. Mr. Gough, I just want to conclude your evidence just by asking you for really some reflections on some of this. And some of it you've already touched on. First thing I would like to ask you about is for your thoughts on the effects of the problems that you experienced in the hospital on John. What impact did those problems have on him?
This is not an easy process for anyone. Cancer is not an easy thing. There's no polite way to put it. It's not easy. I hope this is the only time we have to deal with it in our lives. What went on directly what went on because of the infection jeopardised my son's life. You know, the hospital-acquired infection, to me, and I suspect from the expert, including the experts would also flag, was the most serious thing that happened during that period of treatment. Before my son got treatment, he was a dead boy walking, and the doctor saved his life. But the hospital jeopardised my son's life. They poisoned the building, poisoned my son, and that is disgusting. It's disgusting that X amount of millions of pounds has been sent that put my son in harm's way. Someone somewhere needs to get their backside kicked, whether that's the designers, whether that's the builders, whether that's the clerk of works who signed it off, but someone needs to be accountable for this, because as much as I'm happy and half full and everything else, this is not right. This is not right that the money has been spent, hard-earned money has been spent to produce a building that is state-of-the-art that is not fit for purpose. And this building made my son really, really unwell. And not only that, but it also meant that he could not access the facilities that were set up that were designed to make him better, both physically and mentally. You know, the building, because it was so appalling, meant that he had to change rooms. He couldn't stay in Schiehallion, and Schiehallion was designed to deal with all John's needs, and not just the physical needs, but the emotional needs and all our needs. And his process of getting better was impacted by moving out of Schiehallion. And the doctors and nurses within Schiehallion did an incredible job, considering the circumstances. But there's a reason why we have oncology wards that are specifically designed as oncology wards, and that stopped. And that really impacted on him. And it's a testament to him that he's come out the other side as balanced as he is, because I wouldn't have done. It angers me that if you produce, it angers me that this building wasn't fit for purpose. And yeah, that nearly killed my son. And if I made a seatbelt in a car that didn't function properly and someone got killed or almost killed, then people would be going to jail, you know. And that's what's happened by not installing drains properly, by not building buildings properly. Children are the most vulnerable children are being put in harm's way, and his process of getting better was slowed by this, and both physically and emotionally. I think the changing of location wasn't easy for him because he was so isolated. He stopped being a child. He became a cancer kid rather than a kid with cancer. And that wasn't fun, but hindsight's a great thing. Fundamentally, we have a son, and that was from the hard work of the doctors and nurses and cleaners and everyone else. And I thank them from the bottom of my heart. And I suppose what amazes me even more is that due to the management of the situation, it made everyone's life difficult, not just ours, but the people at the coalface trying to make children better. And how they didn't lose more staff is amazing, because I wouldn't have been able to hack it, which again all affected the survivorship of my child. And this whole situation fundamentally has affected the survivorship of my child, and that's tough, and has slowed the recovery of my child. And it's not great, but we have a son, so that's all that matters. But the journey was difficult, made an awful lot more difficult by this. So yeah, not easy.
What about the impact on other members of the family? What about your wife?
Yeah, we've all struggled. Colette struggled. She has had a lot of help post-event, particularly dealing with the events related to him circling the drain. They use phrases like post-traumatic stress, because it is seeing your child almost die is one of the more traumatic things you can imagine in your life. And we were very fortunate to be able to access some of the charities, like Jack's Den, who's done a huge amount of work with us all, particularly Colette, and other charities like Logan's Fund, who seem to be able to pick up the phone. Cameron at Logan's Fund just picks up the phone whenever you're having a really bad day, just knows instinctively, but had an awful lot, and still do. But all this stuff still has an impact on us. Cancer doesn't go away, and maybe that's the thing about it. Is cancer doesn't go away. It's still there. The phrase we use is scanxiety, because every time you go for a scan, you wait for that to show another mass. So we always have that fear in our system, but you don't expect the post-traumatic from seeing your son have a huge line infection, and that's been hard. And she's still working through it. We're all still working through it. So,
What about you?
Wasn't easy. Still isn't easy. I had an awful lot of support from my work, which was great. You know, I'm very fortunate where I am that I've had that support. It made life an awful lot. It put an awful lot of responsibility, or I took an awful lot of responsibility whenever I went into the hospital. There was an awful lot of pressure there, because there was a lack of trust in the buildings and some of the protocols. No, there was a lack of trust in the lack of protocols in outlying areas apart from Chehallion, and that's big, because you're already dealing with the fact that 1 in 10 might not survive this, and you don't want to be a factor in that 1 in 10. And yeah, and again, not easy. Cancer isn't easy, but we didn't need this. God, we didn't need this. That didn't help. But he's fine. That's all that matters. I'm really being brutal. That's all that matters. But what the important thing is that this doesn't happen again. And these, you know, because, yeah, buildings shouldn't poison children.
You're obviously a man who rationalises things, thinks through problems, and we can see throughout your statement evidence of that, quite apart from the issues with the hospital, but even just in terms of dealing with John's illness and his treatment. You talk about the variables. And do I understand from what you're saying that effectively the problems that you experienced in the hospital, line infections from the hospital, question of whether you would get the same care in other parts of the hospital. Communication around these things. These add other variables from your point of view.
Absolutely. That was, you know, you change your odds. So again, doing the maths, 3 o'clock in the morning, if you change from a 10% fatality rate to a 15% fatality rate, if that even affects it by 5%, that's a big number. That's another person dead in this room. Because the protocols aren't followed.
How do you feel about the fact that you were put through that?
Angry, upset. It shouldn't happen. It's fundamentally, it's not rocket science. Really, it's not rocket science. Drains should drain away from, you know, how difficult is it? How difficult is it to make air conditioning that works? People have been paid an awful lot of money to do a job that hasn't been carried out properly. And while the hospital itself probably didn't expect this, so you know, how do you cope with something that you don't think is going to come along? You know, expect the building toxic. So you give them a wee bit benefit of the doubt. You know, really the alarm bells should have been ringing after a month of being in a new building, of having to move. You know, if it couldn't be sorted within a couple of weeks, then they should have been looking at different measures, strategies. And I felt that there was decided lack of planning as well, which wasn't great either. The Heath Robbins approach gets you by, but getting by only lasts for weeks, not months, not years. And it feels like they've just been getting by for years. That's not good. Because getting by isn't great when your child's got a broken arm. It's utterly unacceptable when your child's got cancer.
Something you say in your statement that resonates with me in relation to what you've just said. Describe children with cancer as sailing close to the wind.
Yeah, and very much so. That you're. It's why I use the analogy of the room, because actually people don't get. You know, it's a scary word, but you don't get. And 1 in 10, 1 in 5 is good numbers. And I quote, Wilm's tumour, that's a good cancer to have. It's a good cancer to have. Because it's only 1 in 5, 1 in 10. That's only 50 people in this room. That's not that many. But there's a lot of cancers in here which are 50%. So that's you have people dead. That's sailing close to the wind. So we have to do everything to protect these children because they are so vulnerable. And that means that if you are commissioned to design and build a building, protect these children, then by heck you should do it properly. If you're a plumber going into a room installing pipes, you should make sure that they drain. For God's sake, make sure that they're drained. It's not difficult. Really, it's not difficult. You're going into a room afterwards, checking up. That's not acceptable.
Do you feel that your experience of the hospital, it wasn't built in a way that
Absolutely not.
did that?
Absolutely not. If someone had installed the infrastructure in any of our houses the way the infrastructure was installed there, you would have been kicking up merry old hell. It's not acceptable. If it's not acceptable for your house, it's not acceptable for immunocompromised children.
Mr. Gough, I don't have any more questions for you. I just wondered, before you finish your evidence today, and I think it is your preference to finish today.
If that's okay, there's only so much you can listen to me.
Or indeed me. I wondered if there was anything further that you wanted to say that you've not already said.
Yes, one last thing. Everyone's like, oh, I thought we were at the end of this. One thing that surprised me about this slightly concerned me as well, and it's in the evidence, but I thought to flag up was post being in ortho, we were concerned about the level of care and not wanting to be pushy parents, because we try and be positive, but understanding that there was an issue there. We flagged, following all the appropriate procedures, complaint. Followed all the procedures, saying, look, this isn't right. These are the problems that we encountered. And you'll see from the records, my wife is incredible at keeping records. And the reason for that was the fact that because we were doing shift changes, the only way we could keep those correct, make sure that everything was okay, was to keep records. They're not too bad, these. So when we flagged this as a concern, John's poor treatment as a concern, we were able to put an awful lot of detailed, it wasn't just this wasn't very good, it was this wasn't very good because of all this. I was quite disheartened by the lack of response. You know, it took me chasing rattling cages to get any form of response, and I think it was 6 or 8 weeks to actually get back to us and actually deal with the problem that we had identified. Check that my statement's much more accurate, but really, I think it's quite concerning that I found that quite disheartening as well, that, you know, there's a problem. Rather than being pushy, grumpy parents, we did all that we could to move this forward and make any, you know, the system's not working. We flagged up that there's a problem, and really, we found it disheartening that it took so much for us to be listened to when we were making quite legitimate complaints about the system where our son was put into a position that put him in harm's way, and that wasn't good. That didn't help either. And I know that we haven't touched on it, but I thought it was good to flag that. For me, that was another thing that I found quite difficult is, you know, it's bad enough that this is all happening, but when we are actually throwing up a flare, saying, okay, officially, here's a flare, there's something wrong, and no one sees that or responds to that, then that's not good either. So yeah, that was another thing to flag, that it's not like they didn't know because we were telling them. But apart from that, yeah, we've got a son, that's all that matters. And thank you, Shahalian, for saving our son.
Thank you, Mr. Gough. My Lord, I've not had any requests to ask any additional questions, so that would be to conclude Mr. Gough's evidence from my point of view.
Thank you. I take it nothing arises because, as counsel for the inquiry has indicated, no requests have been received. So that is all the questions, and thank you very much for answering them. Thank you very much, Mr. Gough. Again, perhaps Mr. Gough can be allowed to leave first.